Bismillahirrahmanirrahim. Today we will have case quiz number 49. Case data: 82 years old male, 82, very old, complaining of weakness and general malaise, general pains in the muscles and some pain in the joint, particularly elbows, wrists, and knees. 3 weeks earlier, he fell and his leg and hit his leg and had some local pain related to this falling. 12 years ago, he had a myocardial infarction and was put on beta blocker, but he had not had a prescription for this in the last 6 years. So he received treatment for only 6 years and stopped 6 years ago. 20 years ago, he had cholecystectomy operation. He was retired at the age of 63 years, so around 20 years post-retirement. He lives alone in a second floor flat. His wife died 5 years ago. He had one son who lives in Ireland, very far from his location, and whom he had not seen for 3 years. Examination: he had tenderness over the muscles around the limb girdle, little tenderness over elbows, wrists, and knees. Mouth looks normal, but the tongue appears smooth, more than normal. He had no teeth at all and lost his dentures. There are no abnormalities in the cardiovascular system, respiratory, or alimentary systems. Legs show superficial lacerations on front of the right shin. This is oozing blood and has not healed. This is petechial rash on the areas of the leg. Larger areas of bruising on the arms and legs have not been associated with any trauma. Regarding investigations, hemoglobin is anemic with decreased in mean corpuscular volume, so this is hypochromic anemia, microcytic hypochromic anemia. White BCs within normal, neutrophils within normal, lymphocytes within normal, platelet within normal. So we have two questions in fact. The first question is, what essential area of history is not covered above? And the other question is, what is the diagnosis? Regarding the essential area of history, we need to stress on dietary history, because this is a metabolic disease. This is a nutritional deficiency disease. So we should stress on the dietary history for this patient. And the answer for the diagnosis is, this case is mostly scurvy, vitamin C deficiency. This case is mostly scurvy, vitamin C deficiency. A dietary history is an essential part of any history and is particularly important here, where the number of features point toward a possible nutritional problem. He had been widower for 5 years, living alone with no family support. He lives alone on the second floor, which may make it difficult for him to get out. He has lost his dentures, which is likely to make it difficult for him to eat. He has a petechial rash, which could be related to coagulation problems, but the platelet count is normal. it would be important to examine the rash carefully to see if it is distributed around the hair follicles. A number of features suggest the possible diagnosis of scurvy from a vitamin C deficiency. Body stores of vitamin C are sufficient to last 2 to 3 months. The rash, muscle and joint pain and tenderness, poor wound healing, and microcytic anemia are all features of scurvy. The classic features of bleeding from the gums would not be present in an edentulous patient. Plasma measurements of vitamin C are difficult because of the wide range of normal subjects. In this patient, replacement with ascorbic acid orally cleared up the symptoms within 2 weeks. It would be important to look for other nutritional deficiencies in this situation and to make arrangements to ensure that the situation didn't recur after his discharge from the hospital. The key points are: a nutritional history should be part of any clinical assessment, particularly in the elderly patients and in the very young also, but it is more important in the elderly because it may be forgotten. Maybe in the children we stress on nutrition, but in the elderly we may forget to ask for the nutritional history. This is the first key point. The second is vitamin deficiencies can occur in patients on a poor diet in the absence of any problem with malabsorption. And finally, thank you very much for your attendance, and we will see you tomorrow, inshallah, with case quiz number 50. Wassalamu alaikum wa rahmatullahi wa barakatuh.